Hello, my name is Paisley Robinson, and I'm going to be demonstrating my insertion of a Foley catheter on a female. I'm going to make sure that I follow my general principles and safety practices. I've already identified my patient with 2 patient identifiers. I've assessed them and assessed their allergies. I have confirmed the order, and I've educated them on what we're going to be doing. All my supplies is clean, dry, and intact. I'm going to go ahead and perform hand hygiene, and then I am going to position my patient. Then I'm going to perform hand hygiene and don on clean gloves. I have my basin with soapy water. I'm going to spread the labia. The side furthest from me I'm going to start with. I'm going to start from top to bottom, clean, fold to a new clean side, top to bottom, clean, fold to a clean side, starting in the top to the bottom, down the middle, clean. Then I'm going to dispose. I'm going to perform hand hygiene, and then I am going to open my sterile kit.
Yes, I got a route. Okay.
Then I am going to perform hand hygiene, and I'm going to don on sterile gloves.
All right, I'm going back to the website and put some questions. I'll do that.
I make sure I stay in my 1-inch border. So I am going to step to the side and step back. I'm going to come in, look straight up and step back. Now I am going to organize this in a way that I need it, making sure that I stay within the 1-inch border. I'm going to dispose of that. Go ahead and get my lubricant. Open that. Squeeze that out. Dispose of that. And then I'm going to go ahead and get out my catheter. Going to dispose of that, and then I'm going to go ahead and insert it into the loop. And then I'm going to remove that, dispose of that. Now I'm going to go ahead and spread the labia. I have identified the urinary meatus, and I'm going to go ahead and start to clean. So starting on the side furthest from me, I'm going to start from the top, clean to the bottom, dispose of that. The side closest to me, start from the top, clean to the bottom, dispose of that. Starting from the top, going to the bottom, down the middle, dispose of that. I'm going to go ahead and pull my sterile field closer to me, making sure I stay within the 1-inch border. Then I'm going to go ahead and grab my catheter. And then I am going to, I have made sure that I identified the urinary meatus. I'm going to go in, making sure that I don't touch with my dominant hand, my clean hand, the labia. I'm going to insert. Once I have urine flash, which I do, I'm going to go ahead and insert 2 to 3 more inches in further. Still not touching the labia. Then I'm going to hold with my non-dominant hand. Then I'm going to come over here and I'm going to fill the balloon per the kit's instructions. I'm going to give it a little tug, make sure it stays. It does. I'm going to go ahead, remove, dispose of that, and at this point I can let go. Then I'm going to go ahead and attach this to the leg, making sure that I'm not tugging too tight and that it's comfortable for the patient. And then I'm going to make sure there's no kinks. And then I'm going to connect this, make sure I connect this to the bed and not the rails, making sure that it is below the bladder. And it is. Assess the patient, make sure that they're comfortable, they're not having any pain. I would remove my gloves and perform hand hygiene. I would also clean up my area, position the patient back, provide privacy, and then I would immediately document and report and record.